Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back. And if you're joining us now, we are just getting our first conversation started, and we are bringing you our COVID-19 update. And for our first conversation, we are going to be speaking with representatives from Belize Healthcare Partners Ltd, which is one of the private facilities locally which does offer COVID-19 treatment. And here to discuss the expansion of the hospital's COVID-19 unit, we have Dr. Jorge Hidalgo, who is an internist with the Belize Healthcare Partners Ltd and a very familiar face on our show. We also have Dr. Tania Morejon, who is a general practitioner at Belize Healthcare Partners. And we also have Dr. Shanna Pott, who is another general practitioner. And we also have Minita Concha, who is a registered nurse. Good morning, and my words are escaping. Thank you so much for joining us.
Thank you. Good morning.
Hi.
Yeah. So we are discussing the COVID-19 unit at the Belize Healthcare Partners. And Dr. Hidalgo, perhaps you can get us started just by talking a little bit about the facilities at the hospital as they currently stand, and how you guys have been treating patients who have been seeking COVID treatment.
Yes, good morning, and thank you for having us again. At Belize Healthcare Partners, since the beginning of the pandemic, we say that we have a responsibility with our patients. It was a very difficult decision at the beginning to decide to open a unit, but all of us at the Belize Healthcare Partners decided that we need to offer this option to our regular patients. And then since the beginning, we start with the unit. The unit is completely separate from the main hospital, and also as well as is completely separate from the dialysis unit. We have these three different components at the hospital. That way, the people can feel safe, as well as in the main hospital. At the main entrance, everybody is essentially screening. And when we admit patients to the general facility that is not the COVID unit, each patient that we admit is being tested, making sure that in the general hospital, when we admit a patient, we want to make sure that they are not positive. If they are positive, they need to go and be admitted at the COVID unit. Our COVID unit, essentially, at the beginning, we start with the 4 beds. However, due to the outbreak and also to the overwhelming of cases, we expanded to 2 additional beds. And for the last few weeks, we've been very busy. Then the main idea today is hopefully and wishing that everybody adhere to the social distancing precautions, because we have the unit, but we want to prevent for you to come into the unit. But if you got the COVID, then we are here to help you. But mainly we want to prevent, and we want to send the message to our Belizean people that please adhere to the social distancing measures to prevent to get sick. And in our main unit is that we want to have a conversation from the inside with the doctors and also the nurses that are at the front line. The unit is essentially under the supervision of myself and also Dr. Pedro Arriaga. But we want you have from the inside, from the doctors and from the nurses that are in the front line.
And I'm really interested to hear about the patients that you've been seeing. But before we get there, since you made the decision to ensure that you would have specialized care for COVID patients, how many people have you treated in the unit so far?
Yeah, until now we have been treating around 27 patients.
Yeah. Have you lost any patients in the
Yeah, we
unit?
lost 3 patients.
We've
3?
had 3 here.
Three
Yeah.
patients.
Yeah.
Three
Now,
patients.
But of course, these are patients that came,
In a
we
very
different level of patients,
yeah.
and so they came at very critical conditions.
And you're at capacity. You're at that stage where as soon as one bed is empty, you refill it again.
Yes, like
How-
we've had occasions where we're full, and we have people calling us, trying to come over, and we haven't been able to facilitate them. So we are at capacity, and which is the reason why we expanded.
Yeah. And this is the situation we had all feared. The point where hospitals, whether private and even at some point the public hospital, would have to turn away people, or people would have to wait to be able to access a bed for proper treatment. Now let's talk about what you're seeing. What we know about COVID is what we hear from health professionals. We've seen stories in other parts of the world. Now you all have a first-hand look as to the severity of this disease. What's the first thing you tell your loved ones about people who are being treated and the severity of this illness?
Yeah, the first thing that I would always tell my loved ones is that don't reuse your mask. Try not to go, because my family were so fortunate to live in San Hill, but as well as all of our families here as nurses here in the COVID unit, we take time to educate our families. Stay at home. Try not to go into the city or any crowded areas. We ourselves, we take precautions that we don't go, because if we go out and we get sick, then that will decrease the amount of staffing that we have here. Nurses are much needed all over the world. The next thing that I make sure that I tell my family is that as soon as you reach home from a crowded area or wherever they had to go, take off their shoes and go bathe instantly. And that same clothes that they have on, put that in a separate basket, and try not to touch your eyes, try not to touch your face, and don't take the kids out if not possible. And that's something that all of us take into consideration. And it's also important to stress, and I know it's been said over and over, but to stress, the social distancing, the sanitizing of the hands, washing of the hands constantly, and, wearing of the mask. I see some people even wear their face shields in public and things like this. And yes, we've been saying it over and over, but some people are still not adhering to these protocols that are set in place. And so it has to be said over and over again, and hopefully people start taking heed, because as we can see, the numbers are rising. And COVID is not very pretty. Yes, like I mentioned before, it presents at different levels in different people. But we've seen death, and it's not pretty at all. And people are alone, away from their families, and some don't go home. Some don't get to go home back to their families. And so while we may be young and we can fight the disease, we have to consider those who aren't, those with underlying conditions and things like that. And also consider the healthcare workers and the frontliners.
people are still taking lightly the disease, and we advise the population that this COVID is not nice. We are telling you because we are there with the patient. It's heartbreaking to see our patients, the conditions that some patients come into our facility, and we try our best, but everybody have to understand that COVID is a virus that is hard to treat as any virus, and we do all we can do in our hands. But sometimes, like Dr. Hidalgo said, we have 27 patients, and from these 27, 3 patients died. And I have the experience to see some of them died in my hands, and it's not nice. it's not nice for us doctors. We have to be strong in there, help, and try our best for them. But when they come in a very late stage and there's not much to do for them, it's not easy to see the patients in that condition. So the message for our population is to adhere to the social distancing, wear the mask, and don't take it lightly, because this disease discriminate none. Young people, elderly, people with comorbid diseases, doctors, engineers, any social class.
Yeah.
So that is my message to the population.
And
Um,
I also wanted to ask, just to keep that conversation going, just based on something you just mentioned, Dr. Morejon.
Yes.
I just wanted to ask a bit about what stage does the intervention and seeking hospital treatment make a real difference? And we can also, and then you can also maybe shed some light on sort of the different levels of treatment that patients who are able to access the healthcare partners services are able to receive. Because people mostly think about ventilators and intubation, but of course that's sort of at a very critical stage. So perhaps you can talk a little bit about the different levels of treatment that are currently being offered, and at what stage intervention really does matter.
Let me mention the facility we offer treatment. We offer every service since the beginning. We do the swabbing for patients that they want to come and have an idea about it, if they have or no the condition. If we have the flu clinic, and it's important. I mean, the flu clinic, and also we have a number that will Dr. Tania and Dr. Pott will share, that we can, is our hotspot number where they can call and they can be guided by doctors as what is the situation of the condition and if they need to come. After that, we have our COVID facility that essentially our advice is to the patients to come early. Don't get too late, because if they usually come too late, there are a few things that we can offer. No,
Yeah.
I mean that it's important that they can be in contact with the doctors. That way we can help a little bit more. Dr. Shanna and Dr. Tania, can you add a little bit more?
Yeah, so like Dr. Hidalgo mentioned, we've had the flu clinic since the very beginning, and this is to avoid, even patients that show up to the hospital without calling prior, that they're directed with any flu-like symptoms, fever, anything that could be COVID related. Then they're directed to the flu clinic, where they will be examined, evaluated, swabbed if necessary, and of course given treatment. So again, and also patients who have called previously, people who have been diagnosed, they would call and want to be evaluated. Even patients who may need to be hospitalized and we don't have the space for them at the time, we would still see them there, evaluate them. We've gotten chest X-ray, blood tests, so that we could know the condition of these patients and of course offer treatment.
Yeah.
So the flu clinic has played a very important role in what we offer here. To be able to protect other patients that are coming into the hospital as well, that we don't have people going into our main entrance where they go to see the other doctors who may or may not have COVID.
So let me ask, because we often report on the stories, and we get the information from the family members mostly, that their loved one is diagnosed positive and they seem to be fine at home, or some have not been diagnosed, and then they suddenly, this is how it's described, as develop respiratory distress. They have trouble breathing. That's I think what they're trying to say, and they're rushed to the hospital, and they're either immediately intubated, some don't make it. can you explain to us, what are the warning signs that we need to look for? Is it that perhaps there's a symptom that may have been indicating before that you could potentially be developing a severe form of COVID? Is there a day after being tested positive that you enter a critical phase that people need to know and pay attention to so that we can start preventing some of these deaths?
Well, there is a different, this COVID disease, like I always say to my colleagues and to everybody, it's the kind of funny, like we say. It's a disease that we can see patients in different levels. We can see a symptomatic patient. We can see patients with mild symptoms like sneezing, cough, last the taste, the smell, and we can see patients that start with respiratory difficulties. Those are the patients that need to seek immediate attention. All patients should seek attention to prevent this difficulty breathing. Once the patient has difficulty breathing and reach to our unit sometime, the oxygen saturation of the lungs of the patient is so low that we have to do some interventions like intubation, mechanical ventilation, and another invasive procedure for our patient. And that's why we have the flu clinic, and we have to prevent the patients to going to the intubation. Once the patient start to feel like they can, like they say, they can catch the breath, patient needs to be admitted and hospitalized most of the time.
The other important message is that the condition, it will vary, and that's important. If someone have COVID, everybody will manifest and will present in a different variety of symptoms. I mean that if I have a neighbor that they have COVID, I'm not going to exhibit the same symptoms that they have, but sometimes the neighbors share information and say, okay, I got the COVID and I use this treatment, probably you can use it, but our advice to the community is please get attention, be guided by a physician. Some of them are buying oxygen, but if you are buying oxygen, it's best if you use it guided by a physician, because oxygen, as good as it is, also is a medication that have complications. Mean that the important is that please get the advice of a physician.
Don't self-medicate. So if my cousin got COVID and they were on antibiotics, I won't go on antibiotics because they did.
That's right.
You have to be evaluated because the disease presents differently in everybody. We've seen from asymptomatic to needing intubation. And so everybody presents differently. Everybody needs their own treatment, which is, again, why the flu clinic is important here, that we get to evaluate you and decide exactly what you need.
Okay, to add to what Dr. Shanna said and Dr. Morejon said, that this disease is very funny. I've had an experience where I had a 27-year-old that came in, and physically he looked well. He only had a low-grade fever. But when we did the blood test, his D-dimer was high, and he actually had, I think it was a blood clot. And that's something that you don't see. And then in the end, those blood clots will travel to the lung. And sometimes, worst case scenarios, patient would need intubation. And I fear for the general public is that right now we're seeing patients who are much more older that need intubation. But in the future, I'm afraid that people as young as myself would need to be intubated, and this disease might attack us later on, that this virus might mutate and ended up attacking us young people.
And can you also talk a little bit about once people do or are admitted or are hospitalized, is there sort of an average timeline that they'll need to stay to receive treatment? Because of course we've heard stories of people who have need to be hospitalized for weeks or even months.
That differs for everybody. There are people who have only had to come in for a few days, while there are others that we've had here for weeks. So, and some who don't get discharged alive. So, yes, again, that is something that differs for everybody, depending on the condition in which they come.
Doctora, you were saying something, Tania? Okay.
Yes, depending of the condition that the patient comes, depending of the severity of the virus, and of course depending of how strong the patient immune system is. It's a many factors together. That depends. Some patients just maybe will need 3 days, another 5, another weeks, and another months, like we say. That depends of the conditions of the patients and how the patients, the evolution of the patient and the answer to the treatment as well.
Dr. Tania, you mentioned something earlier, and I think it's one of the things that still puzzles many of us.
Yes.
It's who gets severe COVID versus who doesn't. And I know there's a natural assumption for people that it may be persons who are elderly and that they look unhealthy in some way. Of course, we know these are all high-risk factors. But there are also young people who may not die from COVID, but end up hospitalized. Healthy people that I know that end up hospitalized and require very serious treatment. Talk to me about the demographics that you have seen within the unit itself and what it says to you about who can be severely affected.
Well, we see a variety of people, any ages. Like I say, COVID discriminates no one. Mm-hmm. It can be young people, it can be elderly, it can be healthy, strong people, and actually we have persons, athletic, fit, 30-something, like in their 30s, with COVID-19. We have patients in their 60, in their 70, with comorbid diseases that they have better evolution than some young people. So everything depends on the severity of the virus, the immune system of the person, and like I say, anyone can get COVID-19. Females, male, elderly, child, anyone. And anyone can, the evolution can be as fatal as young or elderly, anyone. Yeah. Anyone.
Now, as healthcare professionals, you've seen your fair share of emergencies and serious health scenarios. Describe to us what you see COVID patients enduring. When you say shortness of breath, I don't know to what extent that means, like an asthma patient who's in distress. What are you seeing, and what are people really struggling with within the hospital setting itself, or when they come to the hospital setting?
Okay, as the nurses here at BHPL, because we have the facility set up really nice, and we have the opportunity to work in an AC setting with proper ventilation, we're able to be in there for up to 6 hours or more if it is needed. However, when we see the patients in there, they're literally fatigued. They can't even eat. These patients, they're struggling to breathe, and sometimes the only way that they could be able to sleep is that if they sit high up. And we're in there, we're monitoring these patients hour by hour by hour, and us nurses, we forget that we do need sleep. We forget that we do need bathroom and need to drink water or eat. But these patients, they really do struggle, and sometimes you go off the shift and you come back the next 12 hours and you say, you know what, I really hope this patient is doing much more better. And sometimes they demise and sometimes they get better. But for me, the way that I've seen it when it comes to the breathing is that
sometimes these people, they can take a quick turn, either left or either go right.
And, I want to go back to something that Marlene said very early on in our conversation, and that is talking about that we are basically at the point that we wanted to avoid, where as she said, that some people who need treatment may have had to have turned away, and you mentioned earlier that that the unit is basically at capacity currently, and I wanted to get a perspective sort of from the other. Or put the shoe on the other foot and really talk about your experience as healthcare workers, because of course one of the biggest reasons why we wanted to avoid the pandemic, other than the needless loss of life, is the overwhelming of the system. And we saw, of course, videos from around the world of people in the halls. We saw doctors and nurses and other healthcare workers working crazy hours, separated from their families, and of course it took a massive toll on the actual healthcare workers and on the healthcare system. So I'm wondering what you can tell us a little bit about your experience at the hospital currently, given that you're now at capacity.
Well, yeah. So Nurse Concha mentioned before about, the fear of staff becoming sick, because we already have limited staff working in the COVID unit. For example, Dr. Morejon and myself work directly back here, and it's two of us. So it takes a lot of sacrifice on our end. The nurses, they work tirelessly. They are, again, we have nurses that are in here, they do 12-hour shift, as Dr. Morejon and myself. And it is overwhelming. But we've been here and we've been doing all that we can. Okay, so.
Well, we are here at the beginning of the pandemic. We are only 2 doctors, but we want to tell the population that we are here and we will be here, and we won't give up. We will continue working tireless, but our families are prepared for this. Sometimes 15 days, and I just sleep in my bed one night. That I have a small baby. She don't see the baby for weeks, but. We're working in a very good conditions in our hospital. We have all the gears the administration provides. So it's not the case that I see videos, I watch television with other parts of the world where the doctors get sick. And at least in our institution, our administration provides those all gears. We have no case of anything, face shield, mask, the complete PPE. So we take care of ourselves. We're working here for months. We swab ourselves. We do the test often, and we always negative.
Thank God.
So you do regular testing with staff. You do regular testing with staff.
Yeah, we do get tested regularly. The whole team gets tested regularly, because we owe that to, the people that we come in contact with and our patients. And of course, we have to be well to be of service in here.
Yeah. And you're high exposure, clearly. But Dr. Pott, they mentioned something that I didn't want to just dismiss. I saw your post of you FaceTiming your baby. And in fact, you actually separate yourself from your baby for periods of time when you're going to be working. Tell us a bit about that and that sacrifice.
Well, it's very heartbreaking. He's only 3 years old, so he does understand to some extent, but he still misses his mom, and of course I miss him terribly. We have very supportive families, and so he's well cared for, but I always feel like no one can care for him the way that I do.
Of course.
But it's a sacrifice that I've had to make for his safety And also for the hours, the long hours that I'm here away from him, I prefer him being with family than a sitter at home. It has been very, very, very difficult. And of course, I try to, put the emotion aside and do what I have to do for my patients. But yes, we FaceTime every day, and I know that he's doing well, and that's important.
Yeah. And thank you for sharing that, because I think why I wanted to ask that is I think that we don't realize the sacrifices that people within the healthcare setting are making. Being separated, we've had nurses say the same thing, they stay in quarantine for 2 weeks away from family if they worked in a flu clinic or COVID unit. So they're giving up everything to just do their jobs. And you all are asking us to just do what's asked of us so that you have less of a load.
And something that I wanted to point out, like sometimes, of course, we don't really go anywhere. So I just took a drive by the seawall over the weekend. And people are crowded out there in groups, drinking, not wearing masks, not social distancing. And the numbers are rising every day. Every day. So not because it's your close friend or because it's your cousin, brother, sister, that doesn't mean that they might not have the virus. And then you take it home to the vulnerable. And this is exactly what's happening. People are just not adhering to these protocols set in place.
People are not understanding that the hospitals are at full capacity. We are short of staff. We are short of nurses, short of doctors. Hospitals are full, and people are not understanding that. From the very beginning of the pandemic, that was our concern. The doctors, nurses concern. The health system for Belize, everybody knows that it's not worldwide. Nobody was ready for this pandemic, but more in our country, no? We are trying our best, but people have to understand the situation of the country, the situation we have. We will continue working hard. Me, Doctora, and we are a team in the COVID unit. Dr. Arriaga, Dr. Hidalgo, all the nurses, Dr. Shanna, and myself. But of course, the message is that people need to be more conscious about this disease. People need to stop going out at night. Well, now at least we have curfew.
But they gather before the curfew.
But even they complain about the time of the curfew, but the responsibility is on you as an individual. The responsibility is on you. Nobody can make that decision for you, but you.
But so I find that people, they should, what works for me as a nurse is that I know that we have the exact amount of nurses now. A couple months ago, I would say 6 months ago, we started with 2 to 3 nurses per shift. Now we're at 5 nurses per shift. And if one of those, and sometimes that's still not enough, because what people don't know is that we work 12-hour shift. And it will take 2 nurses to attend to 1 patient, because we're very vigilant in what we do and we take care of these people hour by hour. Now we have 3 PNs and 7 RNs here, and a couple of the RNs, they're experienced with critical care. So what if we take away those RNs that are experienced with critical care? That's when you have the patient intubated, they're on life support, you have to watch them every hour, write down their vital signs every hour, try to turn them, empty their urine. What if all of those nurses should go down and have to quarantine? Who will take care of these intubated patients? That's something I want to say. We're so fortunate here at BHPL that we have nurses that are experiencing epidemics. We have a nurse we have dialysis nurses, we have experience with emergency care, and with attending to comorbid diseases. However, I really would like to advise people that as much as you want to breathe, do not pull the mask under your nose. Because whenever I go to the shop or in public, it just terrifies me that people have their mask below their nose, and that is very, very dangerous. I myself, I had to have vacation last week. And with my vacation, what did I do? I just went home in Sun Hill, and that's where I spent my week. But when this COVID started, I couldn't get the bus from Sun Hill to Belize City because one, it will be dangerous for me, and two, I was short-staffed people here because I'm also one of the critical care nurses here.
Yeah.
So I had to literally move from home away from my family in Sun Hill and stay here in the city. And I do not like the city. I prefer at home because it's peaceful, the air is fresh.
Yeah.
But you have to give, and this is what many, many nurses around this country, around the world are giving.
Yeah. And there's of course people who are spreading misinformation about masks. And so clearly maybe you all can share your experiences. You wear masks around the clock working in the COVID unit. Does it disrupt you or incapacitate you in any way? And I hate to ask the question, but I just still see people
like
saying
I was mentioning to somebody in the very beginning, it was a bit difficult being in the PPE, the whole, thing. But as the time progressed, it just became something that we got used to. The mask became a part of us. We've gotten so used to it.
24. We use it 24 by in the unit, and we take our hours, our oxygen saturation with mask, using mask 24 by 24, and my oxygen saturation still is 99%, sometimes 100%.
Yep.
So the mask is not affecting anything of us,
course.
and we use.
Yeah, it's just something to get used to.
you just have to get used to it. Yeah.
At this point, I would think that people should be used to it already at this point.
Yeah.
We've been in this pandemic since March.
Yeah.
So Dr. Hidalgo, you're being a gentleman today, allowing all the ladies to speak, but I do have a specific question for you. Just in what we know so far, we are finishing off this year, and there's been a lot of science that we know more now than we did 6 months ago, but there's still a lot more to figure out about this disease. What do we know about treatments that you are employing within the hospitals that seem to be effective? Tell us about how much we are able and equipped to be able to offer adequate treatment for patients as they come in.
Yes, we have, as David mentioned, we have several levels of patients and of course, several levels of diseases. And then in terms of treatment, unfortunately in Belize, as you know, Belize is limited with that amount of resources. No, of course, our facility, we offer different levels. We have the oxygen. We have something that we call it a high oxygen flow machines. That this type of machines, part of the team, we have the respiratory therapists as well. This type of machines, it will allow us to prevent patients to get into mechanical ventilation. And of course, sometimes even with the high flow machine, we end up intubated a patient. But these machines, it helps us a lot to prevent, to reach that stage. In terms of treatment, as you know, several things have been tested and also based on the clinical trials. Many of the medications we thought that at the beginning and also a few months ago that is going to be useful, it proved that no. I mean that we're still essentially with a supported treatment mainly, and also we have access to remdesivir for patients that need it, and that is one of the things. But again, everything is timely. Some of the medication and some of the treatments we offer it will work in a patients if they came in a very early stage and don't wait to get really, really sick. No?
Yeah. Yeah. All right. Well, we want to thank you for sharing the experience that you guys are having. I do have one more question. The treatment that's being offered at Healthcare Partners, have you found insurance companies willing to cover it?
Is it again?
The coverage of treatment, have you found some of the companies open to covering it? Because I know the testing isn't covered by the insurance companies.
Okay, yes, the treatment is covered by the patients that have insurance.
People who have health insurance.
Cover. Yes, they cover.
Okay.
And sorry, just on the question of testing, since Marlene did bring it up, can you also just speak a little bit about the testing facilities that you do offer at the Belize Healthcare Partners, and sort of what are the guidelines or recommendations that you have for persons who may need to or may want to get tested?
Yes, we have the tested facility. We do the rapid tests. Also, we take the swabs that we send to the Central Medical Lab for PCR, and also we're working in collaboration with the Ministry of Health for the acute febrile illness program. The PCR and the acute febrile illness program testing, those are free of cost. No, but we do the swabbing, and those tests are sent to the Central Medical Lab for testing. No, Dr. Tania and Dr. Shanna, they will be working on that for several weeks. They probably can expand a little bit on that.
Okay, so Gavin, your question was what?
The testing.
Okay.
Just
So
about the testing facilities currently available, and any recommendations that you give to the public.
people would come to test if they've been in contact with somebody who have tested positive, or if they start presenting with any flu-like or febrile symptoms. And so, of course, if they could afford to come to be tested with the rapid test, then we do offer that service. Some people don't have any symptoms, but they ask for a test because they know that they've been in contact with somebody who has tested positive.
And the ideal wait time after exposure is 5 days, 7 days? What is it?
5 days, around 5 days.
Okay.
Yes.
And they should isolate clearly before they get that test. Yeah.
Of course.
Yeah.
Yes.
All right. Final advice, just as we close this off. Can one of you just remind the public once again? We hear it from all sectors, from the Prime Minister, the Commissioner of Police. We say it, I'm sure, annoyingly so to the public, but from you all who are directly treating people in the critical state that COVID-19 has put them in, what is your message to the public?
Stay home.
Use your mask properly. Don't reuse dirty masks.
Wash your hands, sanitize, but stay home.
And bathe. Take off your clothes after you've gone do your shopping or after you come back from work. Anything else?
Adhere to all measures that Ministry of Health and everyone is telling day by day, second by second. Social distancing, wear the mask, all this. So we won't be in the position to sometimes turn back patients, even critically, because we are in a full capacity. Please wear your mask and stay at home and keep social distancing.
All right. Well, thank you very much for letting us know how things are going at the COVID-19 unit at Healthcare Partners. And I know you really wanted to ensure that people know that you have separate facilities for your main hospital, separate facility for dialysis, and a separate facility for your COVID-19 patients. Thank you once again, and please stay safe.
Thank you to
Thank-
have it. So nice.
Thank you.
Thank you.
All right. And from the situation of COVID-19 to it may be something you have lost track of, but we are still seeing the effects of the floods from Hurricane Eta and Iota. So we're going to hear from the NEMO minister himself the assessments that have been done so far and what's the extent of damages we're looking at. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.